We do have two representatives of both sides. The format will be, each representative will be able to introduce themselves, let you know who they are, who they might represent, and then give their position. There is a change. Tracy was supposed to be here, but instead we have Victoria. She is representing the yes side, and Chris Galloway is representing the no side. They'll have a chance in a few minutes to give a 5-minute presentation. There's some 3x5 cards floating around. If you want to ask a question, write your question on the card, raise your hand. A representative of the league will come by and pick the question up, and they'll get it to me. They're going to be screening questions so that we don't get duplicates and things like that. Also, when each representative will answer the question, they'll have 2 minutes, I believe, if I'm not mistaken, to answer the question. And the league is also providing us a timekeeper. So then at the end, we'll have 3 minutes where each individual representing each side will have an opportunity to give their closing statements. So let's just get ready to have a really good, insightful discussion. So let's start with Victoria Zeit. Is it Zeit?
It is.
Victoria Zeit first. Give us an idea of who you are, and then give us a synopsis of your position.
Great. Thank you so much, and thank you to all of you for being here and for caring enough about the community and caring enough about this issue to be here to hear from us this evening. My name is Victoria Zeit, and I am working with the Yes on Issue 2 campaign in favor of the Drug Price Relief Act that's on the ballot this November. My colleague Tracy Jones, I think, will join us a little bit later, and I look forward to you being able to hear from her also. I have been an activist here in Ohio for several years, working on many issues from Cincinnati, have worked on many statewide issues, but one of them being these issues around affordability and access to care. And I think that there's no question right now in our state that we're suffering from an affordability, a crisis of affordability around health care. There are so many people, and I can't imagine that those of you in this room don't know people who aren't able to afford the care that they need, and especially aren't able to afford the prescription medicines that they need. And one of the reasons that one of the main sponsors of this issue is the AIDS Healthcare Foundation. The AIDS Healthcare Foundation is a nonprofit. They operate around the world, but also in Cleveland and in Columbus, and serve patients here in Ohio. And their mission as a nonprofit is to help people who can't afford their care to make sure that they can get care. And they see as part of their mission that in order to make sure that more people can get the care that they need, means that the system has to change. So prescription medications are more affordable and can be available to the people who need them. And that's what this initiative will do. So what this initiative does technically, as you heard, is a pretty straightforward initiative that's going to create a state law when it's passed. And what it does is say the Veterans Administration already has the ability to negotiate on medicine prices. And so it says the state of Ohio will get the same rate that the VA pays, the state of Ohio will pay. And we know that what that rate is because the VA publishes that rate. They have 17,000 medications that are on their formulary, and they have a list of what those medications are and what they cost. And that the state of Ohio will get to, when the state of Ohio purchases medicines for people on Medicaid, for state retirees, for state employees, that the state of Ohio will get that same price. It's almost as if the VA has like a Costco card with the drug companies, and we get to join their Costco membership as the state of Ohio. So that means that 4 million people or more will have the opportunity to have lower drug prices. What about the rest of us, the rest of Ohioans? It means that our hard-earned tax dollars are getting a better bargain, a better deal on these life-saving medications. And it means that our tax dollars are being spent on priorities in our communities, on first responders, on schools, in tax relief, and not going to drug companies and going to the drug companies that pay their CEOs in the tens of millions of dollars every year. We know that our tax dollars are better spent in our communities here in Ohio. So, that's why over 200,000 Ohioans signed a petition to make sure that we're going to have the opportunity to vote on this issue and to be able to make this issue state law this November. And it's why we have endorsements from family from the Ohio Family Physicians, from the Nurses United Union, the largest organization of nurses in the country, and from many elected officials who know that these tax savings are going to be better spent in our communities than by making drug company CEOs even richer. Now, you've probably heard more from the no side than the yes side. We know that. They have a lot more money than we do. The no side is being funded not by a nonprofit like we are, but by a consortium of the big drug companies. So they're spending about $2 million a week on television. They defeated a similar measure in California last year that was also intended to bring price relief for medications, and they spent $126 million to defeat it. They're going to make sure, and you have to ask yourself, if a drug company is going to spend that much money, if these drug companies are spending that much money, why do we think they're doing it? And they're clearly doing it to protect their profits, and they're doing it because they know this is going to lower prices for Ohioans and save us money. It's not right. It's not right that people in our community can't afford, that there's a cure, that there are cures for the medications and the diseases that they have, and there are cures, and people can't afford them. And people are sick, and people are dying, because drug companies need to make even more money. They're still making a profit when they sell it to the Veterans Administration. They have to make so much money that it's worth having patients not being able to afford their medications. And this is our opportunity. This act is our opportunity to change that. By voting yes, it means that we have an opportunity to bring tax dollars into our communities, lower medication prices, and hold these drug companies accountable. Thank you.
Thank you, Victoria. Keep some middle notes of what they're saying, because once they finish, we're going to be asking questions. And so if something they say prompts you to think of a question, keep that in mind, because you're going to have a chance to answer that. Now, Mr. Christopher Galloway, and he represents the no side.
Thank you so much. First, I'd like to thank the repository and the League of Women Voters for this opportunity to talk about Issue 2. As was mentioned, my name is Chris Galloway, and I am with Ohioans Against the Deceptive RX ballot issue, also known as No on 2, for just the abridged version. I think what you heard a lot about in the discussion for the last 5 minutes really revolves around a lot of emotional hot buttons, and as well as touching on things that this issue doesn't address. This issue does not address the overall healthcare situation in this country. This issue does not address accessibility to healthcare. This issue does not address in any way accessibility to drugs. Really what this issue is first and foremost, it's unworkable and unimplementable. You hear that the state of Ohio would be required to buy drugs at the price that the VA buys those drugs for. The problem is, even though they do have a listing of drugs that they do purchase en masse, in bulk, a lot of those prices are not actually known, because the VA has private and confidential agreements with the pharmaceutical companies for additional discounts, which means that the actual price of the drug is not actually knowable to us. So what this issue is asking is for you as a voter to establish a level of government bureaucracy in the state of Ohio to chase its tail, trying to determine what the price is that the VA is charging or is being charged for a particular drug, and there will be really no real way for the state of Ohio to find that out. Now you could say, well, why don't they could just ask the VA. Well, the VA won't release that, because that is it's confidential, and federal statutes supersede state statutes. So the idea that this would be somehow readily available is not accurate. Let's do a real quick exercise here. Who here is on Medicare? Okay. Who here gets your? Oh, keep the hands up. Keep them up. Who here gets your health care from your employer? Okay. So all of you in the room that raised your hand, or kids in the back, you get your health care from your parents, probably get it from their employers. So everybody in this room that raised their hand, this doesn't apply to you. You're left out. So under even the best case scenario that the yes side would like you to subscribe to, 2/3 of Ohioans are not affected by this issue at all. And I think that's a very important point to make. They have a commercial running. It shows a woman talking about with an EpiPen, and she's talking about her deductible. Well, the irony of that is she's getting her insurance through private means. This wouldn't apply to her. So she's in their commercial and she's talking about an EpiPen, and it doesn't even apply to the individual giving the testimony in their own commercial. Ohio already pays a price on most drugs very close to the VA. Under federal law, Medicaid drugs, which represents 75% of what the state of Ohio purchases in drugs, is at a federally mandated rate, which is a 23.1% discount. So if the VA is at 24, Ohio on 75% of these drugs is already at 23.1% federally mandated on that discount. So the amount of savings can be seriously questioned with this proposition. Lastly, you see the ballot language. It's up here. I've got a copy of it. One of the components that's in it says that if you pass this, the state of Ohio will have to pay the legal bills for the 4 petitioners that are designated on this issue to pay their legal bills if they choose to sue the state of Ohio on any matter related to this. So that means that you're on the hook in perpetuity to pay the legal bills of their side whenever they decide whether or not that there's been a violation of the law, or as they see it. The gentleman behind this issue, the California healthcare CEO, has already engaged in 52 lawsuits in 7 states. He's already sued the state of Ohio. You're kidding yourself if you don't think that passing this issue will not open a can of worms of endless lawsuits, cost to taxpayers, with no actual savings. Thank you.
Now each individual will have 3 minutes to sum up their position. Who went first?
I went first before.
Okay, so let's go with you first, Chris.
Sure. Thank you again to the League and the repository for having me here this evening to talk about issue 2 with you. I think we've heard a lot of emotion, a lot of discussion on the healthcare issue as a whole, on the sort of the moral imperative in terms of healthcare accessibility, the overall cost of drugs, but none of those things, as well-intentioned and flowery language that might be, actually has anything to do with the issue that's going to be before you on November 8th. On November 8th, there's a very simple ballot initiative that will be in front of you to decide. And what that says is that the state of Ohio would be required to purchase drugs at a rate that no higher than the VA pays for it. And what we've talked about on the no side, and there's 70 organizations that oppose that, is that it's unworkable. It doesn't cover 2/3 of the folks in the state of Ohio. And there's the potential for costly for taxpayers to have to pick up the tab on costly lawsuits. And so that's why I encourage you all to continue to educate yourselves, investigate the issue, and ultimately vote no on November 8th. Thank you.
Thank you, Chris.
I'm following my opponents all over the state, and they always end with, their emotional response. I'm starting to take it personal. Like, are women the only emotional ones? I am emotional. This is really, really important. The bottom line is we got to start somewhere. Let's just get a baseline. Let's use it's worked 25 years for the Veterans Administration. Let's give that a shot. It boggles my mind that my unworkable, I think that's a word, I'm not sure. Teacher in the room, I'm not sure. Unworkable? Are you sure it's not unworkable? Let's make sure. Let's try it. You're spending $2.2 million to tell us what won't work. We know there hasn't been anything on the ballot in the last 10 years. Nothing. Our legislator hasn't even taken this issue up. So how can it be unworkable? We haven't even tried. Let's give something a shot. We know for a fact that it is possible to examine what the prices are. Let's give that a shot. The lawsuits, there'll be no lawsuits as long as Mike DeWine does the will of the people. That lawsuit's gonna be brought by me. I'm not interested. I'm not interested in suing anybody. I just want the will of the people to be done. It says reasonable. The only thing that we want to do is protect the 4 folks that put their names on the ballot, that stepped up and said, I will go. That's the only thing that we're asking for. And we know for a fact that if we do nothing next year, if the Vivitrol, the drug that is helping opiate addicted folks right now, is 15 grand. If we do nothing, what's to say it's not going to be 16 grand? There's nothing to stop them from increasing prices. Nothing. So let's give them a shot and say, this is the boulder going down the hill. It won't fix it for everybody out of the gate, but this is a chance for us to poke them in the eye and say, this is the beginning. You guys are gonna listen to us, and we're gonna start today. I thank you.
Let's give both panelists.